Control Director at University of Chicago Medicine. When the nation's experts and state experts agree that the virus may become significantly more pervasive in the coming weeks, it's important to listen to them, and I am. I say this as we come off of a Thanksgiving holiday when many people may have dropped their guard and gathered with people from outside of their own households. The hope now is that we can fend off the surge in the next few weeks to get to a healthier holiday time in the latter half of December. We'll be watching the data closely to monitor for a Thanksgiving-related surge in our case count, our positivity rate, our hospitalizations, and ICU admissions. My prayer, our collective prayer, is that everyone stays healthy and that the numbers continue their downward trajectory. And I ask the public to join us in making that prayer come true. So thank you, and with that, I'd like to turn it over to Dr. Ezike.
Again, I extend the post-Thanksgiving greetings. Hope everyone, even in this difficult year, was able to see that there's still so much to be thankful for. Again, as the governor also said, I hope that people did connect with family and friends through a phone call or a video or through drive-by visits and drop-offs of food. But for those of you who did spend Thanksgiving with others outside of your immediate household, I would urge you to get tested later this week. It is recommended to wait about 6 or 7 days after exposure to be tested, but if you have symptoms, please get tested right away. And in the meantime, please exercise the cautions that we are always supposed to be following. Also encourage those whom you were with to be tested as well. In the last 24 hours, over 67,000 tests have been reported for a total of 10.5 million tests in Illinois. Since yesterday, 6,190 new individuals were diagnosed with COVID-19 for a total of 726,304 unique individuals who have been diagnosed with COVID since the start of this pandemic. This unfortunately includes the report of 85 additional lives lost, just reported in the last 24 hours for a total of 12,278 deaths in Illinois. 5,849 individuals were in the hospital overnight, hospitals across Illinois, and of those, 1,217 were in the ICU, and 715 were on ventilators. There is hope on the horizon, but while we await a safe and effective vaccine, it's important to remember that we need to continue to be vigilant, to wear a mask, to stay at least 6 feet away, to avoid crowds, and to wash our hands very, very often. And once a vaccine does roll out, and as you've heard, that could be very soon, we will still need to stay on our game until the vaccine is widely available and in people's arms. We need to take a layered approach. Just as if you were trying to avoid car accidents or car accident deaths, you would not only wear a seatbelt, you would not only avoid texting and driving, you would not only have the car with airbags, you would not only follow speed limits, you would take advantage of all of that. That's a layered approach. And just the same way, combining hand washing with maintaining distance, with washing our hands and avoiding crowds, and once it's available, getting the vaccine are all the different layers that we will need to take up in order to get the greatest protection. These actions that we take now can change how much virus is circulating in our communities and can change what our landscape looks like in the coming weeks and the coming months. We have been fighting this pandemic for so very long, and many of us have suffered in so many ways. But if we stay the course yet a while longer, we will end this pandemic soon. Thank you so much. Buenas tardes. Espero que la gente haya podido disfrutar un fin de semana festivo y haya conectado con familiares y amigos virtualmente. Sin embargo, para las personas que pasaron el Día de Acción de Gracias con otras personas fuera de su casa, deben hacerse una prueba esta semana. Se recomienda esperar como 6 o 7 días después de la exposición para hacerse una prueba y inmediatamente si tenga síntomas. En las últimas 24 horas, más de 67,000 pruebas fueron hechas para un total de más de 10.5 millones de pruebas en Illinois. Desde ayer se han reportado 6,190 nuevos casos de COVID-19 para un total de más de 726,000 casos en Illinois. Recibimos el informe de 85 vidas perdidas en las últimas 24 horas para un total de más de 12,200 muertes aquí en Illinois. 15,849 personas pasaron la noche en el hospital con COVID-19 y de ellos 1,217 pacientes estaban en la unidad de cuidados intensivos y 715 pacientes estaban en ventiladores. Hay esperanza cerca, pero mientras esperamos una vacuna segura, es importante recordar que debemos seguir estando atentos a practicar los 3 M's. Usar su máscara, mantenerse 6 pies de distancia y lavar las manos con frecuencia. Una vez que se lance una vacuna, todavía tendremos que continuar con estas prácticas hasta que la vacuna esté ampliamente disponible. Necesitamos adoptar todas esas acciones. Combinar lavando manos, el uso de máscara, evitar grupos de gente, mantener la distancia y una vez que esté disponible, poner la vacuna. Todas estas niveles de acción nos ofrecerán mayor protección. Las acciones que tomamos ahora pueden cambiar la cantidad de virus que circula en nuestras comunidades. Llevamos tanto tiempo luchando contra esta pandemia. Si mantenemos el rumbo un poco más, podemos acabar con esta pandemia más pronto. Muchísimas gracias para su apoyo. And with that, I'll turn it over to Governor Pritzker.
Thank you. Thanks, Dr. Ezike, and happy to take questions. Mary Ann.
Can we start with the LaSalle Veterans Home?
Sure
Is
can.
an independent investigation needed? And how is it possible that those who tested positive continued to work there when there was, no matter if there was an outbreak or not, but why would someone come to work who
Yeah.
tested positive?
Yeah. Let me begin by answering the first part of your question, which is, should there be an independent investigation? Absolutely, and that's why we brought in the DHS Inspector General.
He's not independent.
And asked, well, yes, he is. The inspector generals are independent. They are asked to do this kind of work all across government in an independent fashion. I do believe that, when they turn in a report, their interest is the public's interest in revealing whatever may have occurred on an independent basis. That is what they do. But look, I agree that every aspect of this should be looked at. As far as I'm concerned, it's never acceptable when we see rampant infection somewhere. Now, remember, this virus is virulent. Whenever it gets into a facility like this, and it usually comes in through somebody who's coming in the door, right? It's not the people who are there already who are negative. It's somebody coming in the door and spreading it to someone else, and then it spreads to residents. And I think you know already that the way this works is once a staff person is tested positive, then, and they test, by the way, every week. Staff at long-term care facilities are tested weekly. If there are positives, then they go test the entire residential population. And that's how ultimately much of the virus was uncovered across so many people at this one facility. Families of residents were notified within 24 hours, as is required, and it was posted as is required on the website online. 2 reports so far have been issued. I think you're probably aware. One is the IDPH report, and one of them is the Department of Veterans Affairs, the Federal Department of Veterans Affairs investigation. And again, I put our, emphasis on this by making sure there's an independent investigation by the DHS Inspector General, so that we can reveal whatever it is that may have occurred at this location. If there's any failure of procedure or wrongdoing, then that should be brought to the forefront and people should be held accountable.
Should people be tested, staffers more often? Students at U of I are tested more often. What
Yeah.
about a veterans home? Are they not as important as the students?
Oh, of course they are. And of course, I'd love to have saliva tests all over the state that we could have every day, just like they do at the University of Illinois. But we are testing once a week. We are asking staff to follow certain protocols when they're outside of the facility. In other words, when they go home, because they have such an important duty to the people that we care for in these homes. Dana.
This is about restaurants, from my colleague this time. When certain government entities flaunt their unwillingness to enforce the indoor dining ban, as we saw in McHenry County, does that trigger additional enforcement by state operators like the state police, gaming, liquor to ensure compliance?
Yes, of course, but I want to remind everybody, and Dana in particular, for Chris, that there are only 1,900 state police troopers. They do amazing work, but we have an enormous state, and they cover the entire state. The city of Chicago, just for example, has 13,000 police officers. The whole state of Illinois has a state police force of 1,900. Think about the local police forces and what they add up to across the state, that massively more than the 1,900 that are in the state, among state troopers. It isn't just up to state troopers, by the way, to enforce the law. That's the job of state's attorneys. That's a job of local law enforcement. It's the job of mayors and city councils and county executives and so on. So we ask them, and many of them are doing, in fact, that. The mayor of the city of Chicago, the mayor of Carbondale, and so on, the mayor of Springfield, and the county county board chairman in Sangamon County, who's really done an outstanding job. And of course, our departments of public health, too, are responsible for enforcement. So, we're asking everybody across the state to do what's right, to follow the law. When McHenry County chooses not to follow the law, well, I think the people of McHenry County ought to take a look at whether they want a state's attorney there or they think the state's attorney is really doing his job if he's just not going to follow the law and ignore it.
Might the
I'm sorry, let me get Craig and then I'll come back. Craig.
Questions related to the vaccine. First of all, what can you tell us about what came into O'Hare? I think it was over the weekend, although we just learned about it coming in.
Yeah.
Is any of that coming for Illinois, or do you know where it's going in? And B, your priorities, how soon are you going to be rolling out what your priorities are for
Sure.
who's get
First, let's acknowledge, I think it was Mary Ann Ahern who actually broke that story about the landing at O'Hare, but it didn't get distributed anywhere in Illinois. My understanding is that Pfizer has a warehouse that's south of Kenosha, and so they have storage capability for their ultra-low temperature vaccinations. And so it's my understanding that those went to that warehouse, although I have not confirmed that with Pfizer. That's just something that a doctor told me this morning when I was on the phone, who happens to know Pfizer reasonably well. The second part of that was,
I know-
what are we going to do with regard to vaccines when they,
And
What do we know?
If you can add to, when you answer that generally,
Yeah.
where do teachers fit into the priority list?
Sure. Well, let me start with so we'll talk about teachers in a moment, but I just want to make sure that we're all on the same page. That the EUA has not been granted by the FDA yet for Pfizer or Moderna. Moderna just filed, I think, this morning. The meeting about Pfizer seems to be scheduled for December 10th. Then is my understanding that the delivery will start to take place a few days later, not the next day, although a lot of people talking about 24 hours. But the reality is it'll take several days, and I just heard that on the White House Coronavirus Task Force call moments before I came here. So, our expectation, our hope is that the EUA will be granted on the 10th, and then there will be relatively quick distribution in the next days after that. In terms of where teachers fall, look, you know that some of the prioritization we've talked about, healthcare workers, long-term care facilities, residents of long-term care facilities, as well as staff, and others. But there are a lot of people who are very vulnerable, as you know, who have comorbidities, who are in communities that have been ill-affected because of the prevalence of disease just in general, or the failure of healthcare in those communities. And so those are all part of the consideration of who will get it next. Certainly teachers are very important, but I also want to make sure that as individuals, those adults who are most vulnerable as individuals get it, early, or as early as possible. I also want to remind you that very few, relative to the need, very few vaccinations will be able to be given right after Pfizer delivers these vaccines. And that's because they're only delivering a very small number, relatively speaking. We don't know the exact number. It keeps fluctuating. We originally heard 400,000, then we heard 80,000. Don't forget, there are 2 shots. So when you hear a number, you need to differentiate between the number of doses and the number of people. So it's basically number of doses cut in half is the number of people.
Do you want to see teachers prioritized, though?
Of course, teachers are very important, but I also want to just recognize that we have a lot of frontline workers. There are cafeteria workers in hospitals, for example, who are just as deserving and certainly are on the front lines, just as one example. So obviously, teachers are very important, and we want to make sure they're protected.
Could Dr. Ezike also weigh in on this, on the logistical challenges of delivering the vaccine? And what hospitals, where are you at with the hospitals? People wonder, where are they going to go to get the vaccine, and is it free, and all of that?
It will be free.
All of that right now. Okay. No, there's a lot of information that I know Marianne and everybody else wants to have. And I think we are probably going to dedicate a future press conference to give all of those details, probably this week. But just to give you some top line things, we just had a webinar today with hospitals across the state to go kind of step by step for those who have not enrolled to be vaccine providers, to show them how to go online and do that. So again, there's a process. Many people have signed up. We have additional hospitals. We want all the hospitals. Of course, the local health departments are enrolled. Again, we know that assuming I don't want to be presumptuous, assuming everything goes well with the evaluation in terms of the safety and the efficacy by the FDA, we could have probably 2 vaccines, not 1. And so there are logistical challenges, as you mentioned, in terms of the ultra cold, as you've heard many times with the Pfizer vaccine. So we know that we want to have an equitable distribution. We don't want any corner, no nook or cranny of the state should be left uncovered. The benefit of having 2 different vaccines, again, the Moderna vaccine does not have that ultra cold requirement. So you would preferentially put the Moderna in places, in small communities, in rural places where they might not likely have as many existing options for the ultra cold storage. That one is also able to be divided into smaller portions of 100 as opposed to the Pfizer vaccine, which is in 975. And so we have all those different considerations in terms of how we can roll it out, where we can roll it out, based on logistics and feasibility, access, resources. But rest assured that every part of the state, no part of the state will be left out. All of the 97 certified local health departments will be receiving, will be part of this effort to get the vaccine out. And of course, there are the phases, and there's going to be like a phase 1A and 1B and 1C, and that alone will take, several months to roll out. So it's not a matter of December 10th, maybe there's vaccine several days later, great, we're all set. It's going to take quite a long time, and people need to understand that, quite a long time just to even get phase one rolled out. And then, of course, you'll still have the subsequent phases. So we will be patient because we are in the final stretch, but we still need to hold on to our masks and wash our hands and avoid those gatherings because we still have a little bit to go.
Doctor,
We'll do one more in the room and then we gotta get online.
I got a question
Oh,
on
my
finances. How does the state plan to pay back the $2 billion it's borrowing from the MLF?
It's required, it's required to pay back any borrowing from the MLF over the course of 3 years.
But how do you expect to do that with a rebound in revenue? Is that likely at this point?
Look, our goal, we believe that there will be a federal stimulus, and our goal would be, because that is short-term money meant to fill the short-term hole that was created by COVID, that we would use that, because we're using the dollars from the borrowing to fill that hole, right? That the stimulus would be used in part to fill that hole.
Eric,
So it
would you-
depends on what the
Eric-
size of that.
Eric has the last
Eric
question.
has
He
not
hasn't had a
gotten a
question.
question, yeah.
Little one.
Governor, if we do get this surge after Thanksgiving that Dr. Fauci is fearing and others are fearing, what specific measures are you considering, and are you considering a stay-at-home order?
Well, that's always something I've told you, Eric, and I've been very transparent with everybody, that when we put the Tier 3 mitigations in place, it's short of a stay-at-home order because we may be able to avoid a stay-at-home order. And that's our goal, that's our hope. And if everybody follows the mitigations, and if we don't see as big a surge as is being discussed nationwide, we'll be able to avoid a stay-at-home order.
Could you
What
just
what else is in the
clarify?
toolbox? What else is in the toolbox at this point, short of a stay-at-home order?
Well, we're pretty much, we're right up against the list of mitigations that you could put in place. Obviously, there are a number of other things that are left, but a stay-at-home order is, about the furthest that one could go. And it wouldn't be exactly like the one in the spring if it did happen, but it's not something right now that we think we're going to have to do. What we're worried about is, when you see the hospitalization numbers, we're at a peak that we haven't seen before. At least we've just come off that peak by a little bit. If we got a surge like we've had over the last 3 to 4 weeks, come on top of where we are now, that would be something that would be extraordinarily worrisome for all of us. So part of it is, let's make sure that we're taking care of our hospitals and our healthcare workers so they can do the job that they need to do. Part of it is we've got to get people to wear masks and, remind everybody the importance of it. Part of it is we want to make sure that we get the vaccine out as fast as we can, particularly to healthcare workers, so that we can keep our hospitals going.
Could you just clarify, at the top, you talked about, even though there is some slight improvements here and there, not hospital beds, obviously, Tier 3 is not going to change. Do you worry that the public is going to say, oh my gosh, we did what you told us, there's some improvements, we want loosening, not
Yeah,
tightening?
that's not, so that hasn't happened in many places in the state, just to be clear. We're still seeing, remember, the height that we came off of from hospitalizations was above 6,000. We're now at about 5,850, roughly. So, have we come off by a couple of hundred beds? Yes. Or, we were able to staff still the number of beds as before, but we only have 5,850 that are filling those beds. We want to see those numbers continue to drop. I want to also, just so all of you have a picture, the Tier 3 mitigations only went in place about 10 days ago. So much of what we've seen over the last 6 days or 7 days is not a result necessarily of Tier 3. It's actually a result of Tier 2 and Tier 1 having been in place for a bit. So we're hoping that Tier 3 will bring those numbers down, or at least offset what we might think of is coming, a surge from Thanksgiving. That's our hope. That's our prayer. I think we all want the right things for the state. There is no guarantee this virus, and people's, adherence to the mitigations are very important, how high the level of adherence is, and the virulence of the virus itself. Those all play into the numbers. We don't control the numbers. What we do is try to address what we think might be coming.
All right, guys, we got to get online. John O'Connor from the AP. To what extent does ventilator use predict deaths? Are there statistics here in the state or nationally showing a percentage of people who recover after vent use?
I'm sorry, is the question, do I know what the percentage of people are?
Yeah,
who
maybe
recover?
Dr. Ezike is better for this
Yeah,
question.
I don't think that's a number I have.
There are different studies out, I think we've talked about it before, that in COVID, once people get on the ventilator, from 25 up to 50% averages in terms of mortality. So significant mortality with getting on the vents. Yeah.
Dan Petrella at the Tribune.
Related my mask here. Go ahead.
Last week, you recommended that people get tested if they gathered outside of their household over the holiday weekend. Should they quarantine as well to help prevent a new wave?
Yes, that is absolutely that is the recommendation that's come from the CDC and from other experts nationally, is that even though you've gotten through Thanksgiving, you don't know whether you have it or don't have it just because you're asymptomatic, that the best idea is to isolate.
This is a follow-up from Petrella. Are we hearing from any specific hospitals that are currently experiencing staffing shortages or having a hard time finding enough workers to care for their current patient load?
We are, there's an occasional hospital. They typically tend to be ex-urban or rural hospitals that we've heard from that are having some staffing shortage or some difficulty because they've sort of reached the peak of beds that they can staff properly. But it's not widespread.
Rich Miller at Capital Facts. After 20% of the residents at the LaSalle Veterans Home were killed by COVID-19, which followed 12 Quincy Veterans Home residents being killed by Legionnaire's disease in 2015, is it time to consider turning over these homes to the federal government?
Look, what's most important is making sure that we're doing everything that we can to protect these residents. We're going to do an investigation here to figure out what happened. And we'll make some determinations about how to handle that and what the future is of our veterans homes. But I do want to remind you that, we have we have a number of veterans and a number of veterans homes. And the IDVA, has had a pretty good record in those other veterans homes. And this is a veterans home that's in a community that's got a very high positivity rate. It's deeply concerning, some of the reports that we hear, the rumors out there about staff people and whether they handled this properly or whether there was anybody in a supervisory position who may have known about any failures to follow procedures. That's all deeply concerning. I think we'll have to make some broader determinations after we do an investigation here.
Kelly Bauer, what is the plan for antibody treatments?
Well, I was just on the White House coronavirus task force call, and there is a call for people to give blood so that they can attain convalescent plasma people who have already had COVID-19, so that they can use that plasma for people as a kind of a virus protection. So that's something that we certainly want to encourage, and actually you'll hear us in subsequent press conferences talking about that and talking with the Red Cross about it.
Amy Jacobson, last week an 86-year-old woman died from congenital heart failure. She was tested at the hospital on a daily basis, as always, coming back negative. Yet on her death certificate, she's said to have died from COVID. Are hospitals getting paid, in capital letters, as a COVID death?
Well, I think I want to back up and just remind everybody, Amy, you're always asking the same kind of a question, which is, let me take one exception that might have occurred somewhere. We don't put a name on it, but we'll just talk about the one exception and see what you say. I don't know who this person is or whether that actually happened. Here's what I will tell you. The Medicare provides different rates to doctors for treating different kinds of diseases. So whether you've got the flu and you're in the hospital, whether you caught some other kind of disease, whether you caught COVID-19, they actually get paid at a different rate. Not just the doctors, but the hospitals are actually who get paid, not the doctors. The doctors typically are being paid by the hospitals. So when you say, is a doctor going to fake a death certificate and claim that someone had coronavirus when they didn't really have it, when the doctor isn't really benefiting directly by that, that seems kind of far-fetched to me. But just recognize that Medicare does, in fact, pay a different rate for different types of diseases because some are more serious than others. Obviously, coronavirus is more serious than the flu, although people can die from either one.
Jake Griffin at the Daily Herald. What is Dr. Ezike's opinion regarding the decrease in cases and hospitalizations that we're seeing? Are these anomalies, or do you believe they're a positive trend?
No, that's a fair question. Of course, I'm hoping and praying that it's a positive trend that as the governor stated, that the Tier 1 and Tier 2 mitigations that have been in place for weeks and months are starting to kick in, and that people, after hearing that their hospitals are actually being threatened in terms of their capacity, that has encouraged some additional behaviors. I will share that from working in the hospitals for over 20 years, is it? Yeah, up to 20 years. I do know that the trends around the holidays, that the people in the hospital, the numbers are a little bit lower around holidays. People who should maybe get checked out or should be going to the ER will try to wait till after a holiday. They might want to be at home instead of in the hospital, especially this year. That wouldn't be anyone's desired location. I know from working in the hospital that you really try to discharge as many people before the holiday. So some of those factors may be in play as well. But we had seen even before this last week that there was a suggestive trend of things starting to move in the right direction. And we're just all hoping and praying that does not get reversed with the activities from Thanksgiving.
In general, though, I would just say that it's a flattening that we've seen more than anything else. There's a fluctuation. I told you about a couple of hundred, but you're talking about over 6,000 patients. So when you say a couple of hundred one way or another, that's 2 or 3%, maybe 3 to 4% of the total that we're talking about.
Rachel Hinton at the Sun-Times. How likely is it that Tier 3 mitigations will last through Christmas or New Year's? When do you think the state and health officials will know when some regions can move back to lower tiers?
It's impossible to answer something that's, how will it look on December 20th or 25th? I can't tell you. I mean, this virus tends to surprise everybody.
Shruti at Bloomberg is wondering if you can tell us more about your call with Dr. Fauci and what he said about Illinois and any guidance you received from the vice president today during his call with the governors.
Well, I think I talked about in my comments what Dr. Fauci said during that call. It was very productive. He's been very kind and given me a reasonable lot of time over the course of the last, 9 months. And I'm very grateful for that. He's not the only doctor that I reach out to. I know that everybody's interested in Dr. Fauci, but I, have spoken over the last number of days with some of the great experts that we have here in Illinois, of course, too. As far as the White House Coronavirus Task Force call, it was a review of the timing and the discussion about the number of vaccines that are in Operation Warp Speed that might be coming through the pipeline. There was some mention of the AstraZeneca vaccine. Obviously, Moderna filed today. I think there's an overall expression of optimism, but I also think that the vice president seemed to want to answer questions because there are a lot of questions by governors. We are awaiting from the CDC their recommendations. They have a committee that is making decisions about the prioritization of vaccines. That's something we await. So it was a productive call, but I don't think there was anything massively newsworthy.
All right, Oliviana at WAND will be our last question. When will the restrictions be taken away as the vaccine rolls out? We already have Pfizer in the state, but what happens if Moderna gets approved by the FDA first?
I'm not sure I understand the relationship.
I think she's talking about the fact that it landed at O'Hare, but her main question seems to be, Governor, when will the restrictions be taken away as the vaccine rolls out?
Yeah, hard to say. Once again, I mean, what we're trying to do here is get the infection rate down. And so we'll be following those infection numbers every day, the testing numbers every day as we do. And, you know, again, the numbers of vaccines that are going to show up in the next, let's say, 10 to 15 days are very small. They're going to be used to protect our healthcare workers first and so on. And so, you know, there'll be decisions made, no doubt, about whether we can reduce restrictions based upon both the positivity rates and the hospitalization rates and the case numbers across the state, as we have been all along.
All right, thanks, everyone.
Yep, thank you.
Thanks for watching. And if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.